This is a demonstration of Sandlot Care Manager. This powerful and nimble tool supports truly coordinated care across caregivers and settings, leveraging both claims and real-time clinical information to provide a rich view of patient information. Care Manager reduces administrative cost and improves the efficiency of care coordination, enabling the right care management at the right time from the right resource. For this demonstration, we will show how a care nurse can navigate Care Manager to reconcile tasks and review patient information. I will begin from the task view upon logging into the web-based application with my unique username and password. The task view lists all the items that are due for the user. Tasks may be assigned to either a specific user or to a group of users, such as the Diabetes Care Nurse Group, which supports coordinated efforts to manage the patients enrolled in the care plan. Tasks may be applied to a specific patient, as seen in this example, or to a provider, facility, or health plan. The assignment of the task is configurable, and care plans may be customized to meet specific organizational goals, workflows, and best practices. Also configurable is a priority in which these tasks appear in the queue, ensuring that urgent tasks are addressed in a timely manner by the care nurse or care team. For this example, we'll take a look at this alert on a blood glucose value that came in for a patient this morning. The task view has two panes. On the left pane, I can see all the documentation to do with that specific task, such as which care plan it's assigned to, the name of the task, and the description of the task. All of the text that we see here was auto-generated based on the trigger of a blood glucose value being over a certain range. Within the description window, I can also notate any notes I have from speaking with the patient. I can also change the due date, the priority, assign this task to a specific user or to another group, as well as save or save and complete the task. From the right pane of the task view, I have demographics on the patient. So especially for groups of nurses that are coordinating care, this allows them to still catch up on demographics, upcoming tasks, other care plans to which the patient may be assigned to, as well as relationships, which are basically the community providers involved in the patient's care. So this allows me to catch up on what's going on with the patient, even if I haven't spoken to her directly in the past. From the task view, I can also click on the related content link, which will take me from the task view to the patient chart view. This view will show me the glucose readings for Edith Miller over time. So when I see that she currently has a high value, this will show me if she's had other high values in the past. I can also look at this information graphically. From the screen, I can also review which medications she's taking, other diagnoses that have been made, past procedures, blood pressure, heart rate, etc. From the clinical summary view in the patient chart, I have all the information I need at my fingertips to be able to address Edith's concerns. I don't have to leave my workflow, log into another portal, or look through paper charts to access this information. And keep in mind, Sandlot Care Manager utilizes both real-time clinical information as well as historic claims information to provide a full view of the patient's condition. From the details view of the patient chart, I can see more demographics available on Edith, her current task list. I can also review tasks that have been completed, as well as who specifically completed those tasks. A record of messages that have been exchanged regarding Edith. And from this view, I can also adapt her care plan, or add new forms, new relationships, or new tasks. In this way, we can respond to both the automated triggers that are occurring as data is received, as well as incorporating the human element to address the patient's needs. Returning to the task view, we'll now take a look at some of the form capabilities available within Care Manager. To look at the form capabilities, we'll click on the task for Joseph Fuller, which shows that he is due for a diabetes risk assessment. Same task view as we saw previously. On the left-hand side is everything to do with that specific task. On the right-hand side are all the demographics, related tasks, and care plan information for the patient. For this particular example, we're looking at a diabetes risk assessment form. This is just an example form that can serve as a template, but keep in mind that these forms are customizable. You'll see that the demographics are pre-populated. These forms have data binding, which means that any data that's already available within Care Manager in the patient record will be pre-populated. For example, if we had a recent height and weight from a visit for Mr. Fuller, that information will pre-populate that we see here. In this case, we'll enter this manually. We'll go ahead and fill out this form with the answers provided by the patient. You'll see that each of the items for these questions has a point value associated to it. These are configurable and will help calculate the risk score that we see calculating down at the bottom. We'll say that no, this patient does not have any physical activity every day. We'll say no, he does not eat fruits and vegetables. Yes, he's taking an antihypertensive. And as we go through these responses, you'll see this total change. We'll say no family members with a diagnosis, but yes, confirm that he does smoke cigarettes. So we see now that he has a risk score calculated, he's a high risk for diabetes, and at this point we can save and complete the task. Before we do so, let's look at his upcoming tasks currently. Based on the current information within his care plan and data available in his record, the next item due is to schedule a follow-up with his primary care provider. So we'll call him sometime in the next week to remind him to follow up with his primary care provider. As we save this form, we'll see that that task is removed from our task list and has been resolved, and go to the patient record for Mr. Fuller. As we pull up his record, we see that we still need to have him follow up with his primary care physician in a week, but before then we have some additional tasks that have been triggered as a result of the responses we captured from that form. For example, we need to set weight loss goals. We just established that he's overweight, has a high BMI, and does not have any physical activity. We also need to refer him to a nutrition program. We established he doesn't eat any fruits and vegetables. And we also need to refer him to a smoking cessation program. So these are examples of how the responses that received within Care Manager from the tools are actually stored as discrete data and can trigger additional workflows or interventions. As assessments or forms are completed, they'll also be available under the Patient Forms section within the patient record. This concludes the demonstration of Sandlot Care Manager.